So how effective are over-the-counter medications for your baby? That's what we're going to be talking about on today's video. This is Dr. Bidi, pediatrician at Partners in Pediatrics and Family Health and CEO of Newborn Prep Academy. So today I want to talk about very briefly about over-the-counter medications for your baby, like cough and cold medicines and gripe water. A number of different over-the-counter medications can be purchased for your baby, and oftentimes parents aren't sure if these are effective or even safe. Now, I will say I am not adding in this category of medicines things like Tylenol. Acetaminophen will be the generic name of that medication, or ibuprofen. So that will be brand name things like Advil or Motrin. Those are effective for fever or pain for your baby. As an aside, if your baby is less than 6 months old, ibuprofen is not safe for them, so you should be only doing acetaminophen, which would be Tylenol. But aside from Tylenol and Motrin, Advil, things like that, medications like cough and cold medicines that are marketed for babies, there are a number of them on the market. Very common ones would be Zarbee's or Highlands, and you also have anti-gas medications, things like Milacon, gas drops, and a bunch of other probiotics for your baby as well. Now, I will say, just preface that I am not sharing any scientific information here in terms of research, and I'm only going to be sharing anecdotal information just from what I have seen over the years practicing as a pediatrician for about 20 years now. I find that these medications can have sometimes a minimal benefit when it comes to your baby. For instance, if you have a baby who has cough, a few months old, and you're doing Highlands or Zarbee's, there may be maybe some slight benefit. I haven't found them to be terribly effective when it comes to controlling things like cough or congestion in your baby. And when it comes to gas medications, perhaps maybe one of the more effective ones will be any medication that contains simethicone, which is the same medication we have in Gas-X for adults that are taking it for just excessive gas or bloating. So again, outside of maybe that particular medication, I haven't found the others to be terribly effective. Now, in individual cases, I have had moms who have said they've been helpful. And so because most of these are natural medications where they are just herbal medications, most of them, I believe, are safe as long as you're reading the label and you are looking at the age indications for those medications. But again, I think that at the end of the day, most times when your baby has a cough and cold, it is caused by a virus, and it's oftentimes self-limiting and will pass away in time. Of course, if your baby is getting worse, they're having difficulty breathing, they're having fevers that are not going away, you should seek medical attention from your baby's provider, or take them to an emergency room or urgent care center. But otherwise, I think at the end of the day, for babies, vast majority of babies who have a cough or cold, is really just giving it time for the upper respiratory infection or viral infection to pass. Well, I hope this is helpful for you. May not have completely cleared or helped with the decision to go with these medications, but hopefully it's giving you some liberty to maybe just give your baby some time and for them to recover from a cough or cold, and to watch out for more worrisome signs like difficulty breathing or fevers that are increasing in the height of the temperature, so that you can get them the help they need. All right, this is Dr. Bidi, again, pediatrician at Partners in Pediatrics and Family Health and CEO of Newborn Prep Academy. If you are in the Washington County area in Maryland, feel free to call us for an appointment, 301-791-7060, and we're more than happy to schedule an appointment and help take care of your newborn. And if again you're watching this online, wherever you are, just go ahead and subscribe or like the channel. We will be more happy for you to also share this with friends and family who are caring for newborns as well. All right, till next time, bye now.